I'm Dr. Betsy Nelson from the Hearing Wellness Center. I work at our Duluth and Superior and Cloquet locations, and occasionally Bemidji. So I've been an audiologist for about 18 years, and the first 16 years of my career I was in a clinical setting. I've been with the Hearing Wellness Center for the past year and a half. And it's been kind of exciting to be able to transition to a little bit different role and be able to learn a little bit more about the topic we're going to talk about today, which is how your ears and your brain are working together. So to start off with, we're going to look at a video about how we hear, and then we'll look at some of the scientific developments regarding the link between our hearing and our brain. So, as far as how we hear, sound waves enter the outer ear and travel through the ear canal. Pressure changes cause the eardrum at the entrance of the middle ear to vibrate and conduct sound into the three small bones in the middle ear, which is called the ossicular chain. Vibrations then enter the inner ear through the connection with the middle ear bones. The inner ear, or the cochlea, contains tiny sensory hair cells that react to vibrations. So they'll move back and forth, and it's going to send nerves from the hair cells send messages to the brain for interpretation or hearing. It's not just your ears doing the work of hearing, listening, and understanding, but it's also your brain. And your ears and your brain are linked together. So your ears pick up the acoustic signals, aka all the sounds in your world, and then the ear decodes the information so it can travel to the brain, and then the brain puts the sound puzzle together in a way that makes sense to the brain. So sometimes if you've misunderstood someone, it's because of a breakdown in that system. The better quality of that incoming signal, the better the chances for speech, comprehension, or understanding. The better the cognitive resources, the better the brain can compensate for that missing information or the hearing loss and put it together for you. So now that you understand a little bit more about how we hear, let's look at some facts and figures about hearing difficulties. According to the Global Burden of Disease study, age-related hearing loss is ranked as the 5th leading cause of disability across ages. The other 4 are low back pain, headache disorders, depressive disorders, and diabetes. As we know, the older population is more at risk, with currently 65% of adults over the age of 60 having hearing loss. If you want to look at some more statistics about hearing from the National Institute of Health, they'll be below this video in the description. And as we all know, hearing loss doesn't just affect the person with the hearing loss. It can also affect the well-being of family, friends, co-workers, basically anyone that you spend time with. In fact, hearing loss is associated with something called a third-party disability. A third-party disability is the disability and functioning of family members as a result of the health condition of their significant other. So a 2012 study found that 98% of spouses were affected by their partner's hearing loss in some way. Hearing loss can affect your ears, it can affect your communication partners, and it can affect the brain. And that brings us to the main topic of our video. So hearing loss and cognition has been everywhere in the press lately. You might have even seen some of these recent articles that are linking hearing to cognition or brain health or dementia. Individuals vary greatly in the extent, rate, and pattern of age-related cognitive changes that they experience. So cognitive aging, which is normal aging, involves slow cognitive changes which typically span over decades. That includes reduced speed of information processing. So you ask what, but actually you realize you heard what was being said. You just needed a little more time to process it. Reduced capacity of working memory, greater effort required to learn new information. So maybe your kids decided you needed a smartphone and you need your kids or your grandkids or somebody else to help you learn how to use it, because it's just a little harder to learn all that new information. It's harder to divide or switch your attention when you're processing parallel or interfering information. So it's hard to hear two things or two conversations at at the same time and be able to follow them. In 2011, Dr. Frank Lin from Johns Hopkins University published a landmark study showing the increased risk of dementia with untreated hearing loss. So the researchers in that study found that mild hearing loss had 2 times the increased risk of dementia compared to their normal hearing peers. As the amount of hearing loss increased, so did the risk of dementia. Those with a severe hearing loss had a risk factor 5 times greater than those with normal hearing. The Lancet Commission on Dementia published a modifiable risk factors for dementia across the lifespan study. And 60% of the risk factors are ones we cannot address. So things like genetics and other unknown factors. The other 40% of risk factors were made up of 12 different items that you can see here. Essentially, if we could control for all of those risk factors, we'd reduce the risk of worldwide dementia by 40%. The most consequential of these risk factors is age-related hearing loss. Then that contributes to an 8% modifiable risk. So that means proper management of hearing loss could reduce the number of dementia cases. There were 2 landmark studies that were published in 2023. The first of which is the ACHIEVE study, and that stands for Aging and Cognitive Health Evaluation in Elders. That is a multi-center randomized controlled trial, and that was also published in the Lancet earlier this year. That study had a huge sample size of 987 people, and they followed those folks for 3 years. So the trial was aimed at finding an answer to the question whether comprehensive hearing care, including a hearing aid fitting, would help to mitigate the cognitive decline in the elderly population. Among their key findings is that using hearing aids slows down the loss of thinking and memory abilities by almost half. The other study is the ENHANCE study. ENHANCE stands for Evaluation of Hearing Aids and Cognitive Effects. This is a prospective cohort study out of Australia. They had 160 participants. They all received hearing intervention, including a hearing aid fitting, and were followed for 3 years. Their cognitive tests were compared to people who did not use hearing aids, and their findings were equally as impressive. Cognition was stable for those that used hearing aids, but declined for the group of participants who were not using hearing aids. So those studies are finding some of what we've been thinking for a while, that there is that connection between hearing loss and the brain. A study by Glick and Sharma in 2020 looked into the neurocognitive benefit of hearing aid use. So they found that untreated hearing loss, in this case mild to moderate, left the auditory cortex more susceptible to atrophy. That resulted in the auditory cortex being repurposed for visual and somatosensory processing. So if you look at the picture on the left, you can see that orange and yellowish area there that almost looks like a handgun or something like that. So that's showing you how the auditory cortex is being repurposed for some of those other functions. They fit people with hearing aids, and 6 months post hearing aid use, that auditory cortex was back to processing just auditory information. So that tells us that even just a short period of time of consistent hearing aid use can help improve treatment scores on speech perception and cognitive measures. So it's really a good news story after all. By hearing better, you have more access to clear sound that your brain can process appropriately. You allow yourself to be connected to your world, and it allows your brain to do other things than filling in the blanks or guessing what people are saying. You can communicate better with everyone in your world, and socializing is hugely important to your overall well-being, including your cognitive health. As a hearing care provider, I know that conversations happen everywhere in many different environments. And my role as a healthcare provider is to be your partner in the hearing journey together. So if you find that you're having trouble with your hearing, maybe you're concerned about the effect that's having on your brain, we can partner together to determine your needs as far as hearing goals go, hearing aids or other interventions to help you hear your family member, friends, and other communication partners better. There's solutions for every different need. There's Bluetooth compatibility. You can connect your technology so you can stream different music or movies. A lot of hearing aids now are waterproof or sweatproof, so you can live your life without even thinking about them. They're rechargeable and they tend to be automatic. All right, so just to kind of recap, your ears and your brain are equal hearing partners. Hearing aids can be protective of your cognitive health, and because they're a modifiable risk factor, wearing hearing aids plays an important role in your cognitive health, and you also have the power to positively affect your brain's ability to think and remember. And of course, my team and I would love to be a partner on your journey.